Welcome to another episode of Cutting Edge Health. Today, we're talking about a really interesting article that has been put forth with really a lot of concern from both the lay public as well as medical professionals. It's saying that there are medications that are called NSAIDs, non-steroidal anti-inflammatories, that are causing chronic low back pain. We're going to talk about the validity of that, really whether it's true or not, and what we need to do in order to be able to make good decisions for ourselves as well as those people that we care about. If we haven't met, I'm Dr. Orlando Landrum. This channel talks about how can we be able to help patients and the people that care for them figure out how to be able to make good choices. And today we're talking about NSAIDs and this recent article that really went into depth and detail about how potential anti-inflammatory medications, which have historically been quote unquote relatively safe, have now been suggested to be possibly injurious or causing harm. So for most patients, they've said, you know what, hey, before I even go see a doctor, I'm going to think about using something like aspirin, ibuprofen, Aleve. It's what I'm going to do in order to be able to manage my pain and get through it so I don't have to cry and whine about it. I'm going to be stoic and be able to deal with it. We've known over the last few years that NSAIDs can cause a number of different problems. Things like renal disease, if that's used inappropriately, potentially, i.e., meaning kidney problems, right? We know that it can cause problems with the stomach. You can have issues with areas of having bleeding that's present. You can have issues with now, from what we've heard, the cardiovascular system by having an increase in blood pressure that can result in issues like heart attack and stroke. So we've counseled patients to be cautious, but still we would use it as a first line mainstay of treatment, but just using judgment about when it should be deployed and when it shouldn't be. But now we have this new article that talks about the use of these medications. So what we see is that there have been a number of different publications that have kind of piggyback off of the article. But what it shows is the following: is common medications can prolong back pain when overused. And it was a study that looked at a number of different things. And so this was an evaluative piece that evaluated the study. And what it basically stated is that non-steroidal inflammatory medications like ibuprofen could potentially cause chronic back pain. As they reviewed this study in depth and detail, one of the things that they saw is that it's not a randomized controlled study. It was an observational study. So it wasn't a multi-center trial, and it didn't look at a number of different things. And there have been a number of physicians from places like Mass General and other facilities like Dartmouth that have said, actually, this might cause us to rethink some things, but it's not an immediate transition. So if you can see, it's impressive in scope, but at the end of the day, it may require us to think about things a little bit differently. We talk about how inflammation has been characterized. Previously, we've been characterizing inflammation as if it hurts, put a steroid on it, as you can see here in this article. But when we think back to looking at how this has kind of looked at some other things, what we've seen is that maybe that's not really true. Maybe we need to look at this from a different perspective. So when we look at the actual article, it looks a little something like the following. So this is the actual article, which says it was published in the Science Translational Medicine, and the title is Acute Inflammatory Response via Neutrophil Activation Protects Against the Development of Chronic Pain. And so as we kind of get into the full nuanced piece of it, in essence, what it goes through saying is that the mechanisms mediating the transition from acute to chronic pain remain to be elucidated. But what they believe is that immune cells from subjects with low back pain showed that neutrophil activation dependent inflammatory genes were upregulated in subjects with resolved pain, whereas no changes were observed in patients with persistent pain. And they think, or at least from what they've seen in rodents, anti-inflammatory treatments prolong pain duration, and the effect was abolished by neutrophil administration. Clinical data has shown that the use of anti-inflammatory drugs were associated with an increased risk of persistent pain, suggesting that anti-inflammatory treatments might have negative effects on pain duration. So does this really have valid component that using an NSAID is going to make this potentially your pain be worse and it's going to cause you to have chronic low back pain? Well, maybe, but more than likely, probably not. So let's take a look a little bit more at this study. So when we kind of get into it, what we see is that there is a number of different things that were evaluated, but basically they looked at 98 participants, which really doesn't allow one to be able to extrapolate and say, okay, you got 98 patients, so now we can say that this is representative. The power is kind of small. But moving forward, they looked at patients for about 3 months. So the duration of observation was kind of short term. But what they go on to say is that participants who had resolved pain had none of these changes, but those who had neutrophil-driven upregulation had inflammatory response, which were protective, as mentioned earlier. And what they're able to see is that long-lasting pain was induced by anti-inflammatory drugs, and human subjects reporting acute back pain have been identified to have an elevated risk of pain persistence for those taking NSAIDs. So at the end of the day, when we kind of get through some of the aspects of this, they take a look and they evaluate this. And so they look at kind of a scatter plot. They look at blood cell type and different populations. You can see that there's a whole host of different things. And obviously, we referenced the title to the study prior to kind of getting into the depth of all this. But this is really kind of the summarized version as we kind of get down to the bottom portion. As you can see, elements of their data that's in place, with the component, again, being that they looked at 98 subjects over the course of a short period of time. Is that first, they weren't able to identify pathways specifically that had correlations between the resolved and persistent pain groups. So that needs further clarification before we can start making a lot of speculation about it. And then finally, one of the things that they talked about is the low back pain cohort did not have control subjects without any pain. And so that's kind of important because we really need to be able to have kind of a control and trial arm in order to be able to really be able to assess how well this worked. And as we mentioned, the persistent pain group saw their pain resolve after 3 months, but before 6 months. So to better understand this, you need a little bit more length of time in order to really be able to evaluate that. So let's talk a little bit about how NSAIDs can be useful and what can be the value. And this is an article that's published in Practical Pain Management that says NSAIDs have been used since 1828 easily, if not sooner than that, where Egyptians have actually used willow bark and as a pain reliever, as well as Sumerians. But in 1828, a professor of pharmacy was able to isolate crystals from the willow bark and named it salicylic. So from that, you were able to kind of see this aspect of NSAIDs that were salicylates that were able to be isolated. And so what are some of the things that you can be able to utilize NSAIDs for? So they've been first-line treatments for things like axial spondyloarthropathy, bursitis, low back pain, endometriosis, gout, osteoarthritis, Kawasaki's disease, Paget's disease, polymyositis, tendinitis, all these different things, right? And so there are different formulations that are new that have been actually kind of revolutionizing how some of the areas of pain have been treated. And some of those things include IV meloxicam, which hasn't historically been present. And that has been used both in the perioperative, in the actual OR, as well as outside the OR for improved pain relief. We can see that there have been uses of NSAIDs for perioperative pain management, which has had previously concerns for slow postoperative healing. But what has ended up showing up is that there are certain risk factors that actually are more likely to cause non-union and healing issues, things like age, fracture location, fracture characteristics, and other comorbidities. Some things that can is, so yeah, NSAIDs can, but so can nutritional status, so can tobacco consumption and alcohol consumption. So those things need to be kind of taken into account. We talk about how to be able to look at NSAIDs and be able to mitigate their potential risk. There are things that you can do in order to be able to mitigate the risk. And some of the things that are starting to become more cutting edge are things like pharmacogenetics. So when you take a look and you evaluate the individual, you can see that there are different pathways that result in that person being identified as an ultra rapid metabolizer, or having used that have an increased enzyme activity, for them being a normal metabolizer, or for them having a reduced or poor metabolic metabolizer or poor enzyme activity. And so those things kind of matter, because how those pharmacogenetics influence actual application is how well that medication may actually be utilized. So when we go back to this new study that talks about, well, NSAIDs can potentially cause chronic low back pain. The thing that I would say when reviewing this, when seeing it in the media, when talking about this with friends or with other docs and things along those lines, is the following: is the study is in its infancy. They have seen some things that make it of interest, but not definitive that this can be the end all be all to it causing potential chronic low back pain. The number of patients were small, the length or duration of observation was low, and there needs to be a multi-center trial with both a trial arm as well as a control arm in order to really be able to evaluate this. Again, thank you for joining Cutting Edge Health. As a viewer, we appreciate you and definitely want to be able to bring you the newest topics and have an understanding about where science actually meets care, concern, and how to be able to improve your life and help you punch pain in the face and get back to leading the life that you deserve. Thank you so much and have a great day.